Good afternoon, everyone, and thank you for joining us for this part 2 of the Healthcare Homes Learning Collaborative webinar series, Understanding Billing from the CH Services in Minnesota. After an overwhelmingly positive review response from our first webinar, we're so grateful we could welcome them back for more. I know they have a lot of information, so we'll get started. Before we begin, I'd like to read the Tribal State Relations Acknowledgement Statement. The Minnesota Department of Health recognizes and values and celebrates the vibrant and unique relationship between the 11 tribal nations and the state of Minnesota. MDH believes that the partnerships formed through government-to-government relationship with the 11 tribal nations will effectively address health disparities and lead to better health outcomes for all of Minnesota. Next slide. Just a quick reminder that your microphones have been muted upon entry, so please put all of your questions into the chat. We appreciate it. Thank you. Next slide. We're going to cover one quick healthcare homes update for you, and then we'll get started. Just a quick reminder that accessing our free e-learning courses has undergone a bit of a change. To make our courses easier to find, we have placed a link on our Healthcare Homes Learning Collaborative e-learning webpage. Just click on the link for each course description, and the course link to register for that specific course will be available to you. We hope this makes it easier to find the courses that you're looking for in the Learning Center. Next slide. Before we begin, I'd like to introduce our presenters today. We have Kristen Godfrey-Walters, who is our CHW Training Program and Community Education Director for the Health Promotion and Chronic Disease Division at the Department of Health. We have Lovina Kaba, who is the Outpatient Policy Coordinator, Health Improvement and Benefit Design Team for the Minnesota Department of Human Services. And we have Gao Li, who is the Healthcare Provider Trainer, Provider Relations Training Unit, Medicaid and Payments Provider Services for the Minnesota Department of Human Services. Thank you, all of you, for joining us, and I will turn it over to the team.
Thank you, Catherine. Hi, everyone. I'm Kristen Godfrey-Walters, and as Catherine mentioned, I'm the Community Health Worker Training Program and Community Engagement Director in the MDH Health Promotion and Chronic Disease Division, where I lead state and federally funded community health worker training and workforce development initiatives in collaboration and coordination with the Minnesota Community Health Worker Alliance, employers, schools, and other key stakeholders in Minnesota, including healthcare home clinics. Thank you for the Healthcare Home Program for hosting today's webinar with all of you. This is part 2 of a webinar, as Catherine mentioned, of understanding billing for CHW services in Minnesota. The first part of the webinar that was hosted in June covered the role of community health workers in healthcare home clinics, an overview of the new Medicare billing codes, and more details on the specifics of billing for the CHW education billing codes in Minnesota. So you can find the recording slides and an FAQ, the MDH Healthcare Home webinar page, and then today's recording slides and FAQs will be posted there as well. I will start us off, and then we'll include Gao and Lovina moving forward. Next slide, please. Okay, so today we're going to provide information on new opportunities for CHW services billing through Minnesota healthcare programs. You'll hear me say MHCP as well for short. We'll describe the definitions, overview of services, billing and documentation requirements for new CHI or Community Health Integration Services, as well as resources for all of you for CHW services billing through Minnesota healthcare programs. And we've done our best to cover and answer the questions that you submitted in advance through the presentation portal, and we will have time for Q&A, but any questions that we're not able to answer or cover in the webinar today, we'll include those in an FAQ document as well. Next slide, please. Okay, so many of you work directly with community health workers. You may be community health workers yourselves and familiar with the role. Community health workers do work under a variety of titles, including patient navigator, care guide, cultural navigators, promotoras, and community health representatives. And the key distinction of the CHW role is that CHWs are trained frontline health professionals that come from the communities that they serve and serve as a liaison and link between health and social services and the community to facilitate access to services and to improve the quality and cultural competence of service delivery. Next slide. CHW education, training, and licensure or certification is determined by each state, and Minnesota is the first state with a statewide competency-based CHW educational program based in accredited post-secondary schools. So this is a 16-credit program that's a blend of classroom and field-based learning for those who have a high school diploma or GED. And the curriculum is really designed to articulate with other health professions, as well as being a standalone certificate program. The program is currently offered at 5 schools across Minnesota that offer the program online, and there are some schools that have an in-person or hybrid component as well. And the CHW certificate completion is required for Medicare and MHCP billing in Minnesota, as there's not a board licensure or certification. There's no required continuing education in Minnesota. Next slide, please. Since the certificate program is required to bill for CHW services, I wanted to make sure all of you are aware of the current opportunities in Minnesota for CHW training. MDH has federal funding from HRSA to provide scholarships towards completion of the certificate program, tuition and fees, stipends for on-the-job training through apprenticeship, and development of additional free upskilling or continuing education training for CHWs. So the grant focuses on reaching underserved and under-resourced communities across Minnesota, and the Minnesota Community Health Worker Alliance is our partner and administers the scholarship and apprenticeship program. So more information can be found on their website. Next slide. And as I mentioned, what's called the upskilling component is offering free online community health worker training modules. So these are new modules that have been made available through the HRSA grant, and they're intended to build on those core competencies in the CHW certificate program and expand on the role of CHWs in addressing health promotion and chronic disease prevention topics. And the current modules on this slide include asthma, diabetes, heart health, stroke, and arthritis management. And those all can be accessed on the MDH Learning Center. Next slide, please. This slide outlines the CHW role and scope in Minnesota, which includes bridging gaps between communities and health and social service systems, patient navigation, providing direct services such as health screening and health education, advocating for individual and community needs, and building individual and community capacity. Now, the first webinar goes into more detail on the scope in the context of healthcare home certification requirements, so I won't go into further detail in this presentation. Next slide, please. So what specific roles do CHWs play in healthcare teams and organizations? All of you may know best, but for those of you that are learning more about this today, CHWs serve as patient navigators, providing cultural and language-specific care coordination and navigation of the system, serving as bridges between the patient care team, advocating for individuals as well as communities. They address social determinants of health, screen and connect patients to resources, provide outreach and connection to services such as food, utilities, and public programs, help people access appointments, interpreter services, transportation, prescriptions, really all of those things that help them access care and reach health and wellness services. CHWs bridge and advocate between the patient and the care team, as well as provide health coaching and education. They can reinforce patient education on preventive measures, healthy behaviors, and disease management, and really promote self-management through coaching and motivational interviewing, as well as addressing barriers to care. And community health workers work in many settings. I know we're focused on healthcare home clinics today, but they can work in clinics, the emergency department, the hospital, home, as well as many different community settings. Next slide. So now that I've provided more background and context on the CHW role, I'll transition to what we're all here for, is to provide more details on CHW billing and reimbursement in Minnesota. Minnesota was one of the first states to provide medical billing and reimbursement through state Medicaid for CHW services. However, this has only covered a small scope of the services that a CHW provides, and that limitation has limited the ability for organizations and clinics to finance and sustain CHW positions. And so what's exciting and why we're here today is new in 2024, there was expansion of coverage for Medicare defined codes that expands the covered services to more closely align with that Minnesota scope of practice that I just talked about. And we hope this will lead to more organizations being able to bill for CHW services and the ability to finance and sustain CHW positions as well. So the new services covered in Minnesota for MHCP or Minnesota Healthcare Program enrollees, which includes Medicaid and Minnesota Care, includes services intended to address unmet social determinant of health needs that affect the diagnosis and treatment of the patient's medical conditions. And covered services include assessment and planning, navigation, facilitating access to resources, care coordination, health education, self-advocacy, social and emotional support, and health coaching or motivation to reach care plan goals. And as I call out those covered services, you can hear that they very closely align with the scope of practice for CHWs in Minnesota. And that's what we'll talk more about, is these newly defined services and codes. Next slide. Okay, before I get into the details, I just want to let you know that the following information that we're talking about was compiled based on emerging information from Medicare, as well as from DHS on MHCP billing and reimbursement. There's also a current process right now where CMS is reviewing and revising potential guidelines for 2025. So again, just to say, this is emerging information. And when you get to the details of billing for your organization, please refer to CMS and DHS and your organizational billing guidance for timely updates and detailed information. Next slide. So highlights of the 2024 Medicare physician fee schedule. So the new covered services that came out are social determinant of health risk assessment, community integration or CHI services, and principal illness navigation or PIN services. Today, I will provide an overview of the S2H risk assessment and then focus primarily on the community health integration or CHI services, as these are the specific codes and services that were added to the Minnesota DHS Healthcare Provider Manual on CHW services. Next slide. Okay, so the S2H risk assessment is a new standalone G code for administration of a standardized evidence-based S2H assessment conducted and billed under either an evaluation and management or an annual wellness visit. So the assessment is a review of the individual's S2H needs or identified social risk factors. And the key piece here is they need to really be influencing the diagnosis and treatment of medical conditions. And the screening requirements include housing, food, transportation, and utilities, but can include other S2H needs as well. And what's key about this assessment is this can serve as the initiating visit or authorizing visit for community health integration services provided by a CHW. Next slide. So what are CHI services? These are services really provide to tailor support and care navigation, again, to address those health-related social needs or S2H needs that are identified in that initiating visit that present as a barrier to the diagnosis and treatment for patients. And so this assessment in the provider visit identifies the need and authorizes the provision and billing for the CHI services provided by a CHW. And this lists out in a little bit more detail what types of services are included in CHI services. So person-centered assessment and planning, healthcare access and system navigation, connection to resources, care coordination, health education, facilitating behavior change, social and emotional support, and really leveraging lived experience to meet treatment goals. Again, really valuing the background and lived and community experience and cultural congruence of community health workers providing these CHI services. Next slide. This slide summarizes the new SDOH and CHI codes along with the CHW education codes that have been covered in Minnesota since 2007. So it summarizes those overall services, codes, eligible providers and coverage. I won't go into it all in detail, but I'll try to call out some of the key pieces and can be used as a reference after the presentation today. So on the top line, you see CHW education service codes, and those are for the diagnosis-related patient education codes. Those are the 98960 through 98962 codes that some of you may have already been billing for in Minnesota. And the eligible billing providers include a range of the MHCP enrolled provider types listed in the slide. And then DHS enrolled CHWs are the service provider. And so these codes are specific to Minnesota healthcare programs and are not covered by Medicare. So over on the right of the slide, I tried to outline kind of the differences in coverage. Now, all of the services after that listed on the slide, from community health integration down to S2H risk assessment, these are those new G codes that came out in 2024. And then again, are really intended to address S2H needs. So I'll briefly cover CHI, the community health integration codes. Those codes are the G0019 and G0022. And the eligible billing providers include Medicare enrolled physicians or practitioners that perform that initiating visit for services. And then the CHWs or other auxiliary personnel can perform those services. And so these codes are covered both by Medicare Part B and Minnesota Healthcare Program. And then for all of these codes on the right hand, for the new G codes for Medicare Advantage, they will be required to cover the codes starting in 2025. What's important to notice about the Community Health Integration Code in its difference from the CHW Education Services is that these codes are time-based codes that are billed in aggregate of the time spent over a month. So the G0019 is billed for the first 60 minutes in any month that CHI services are provided by a CHW, and then each additional 30 minutes each month can be billed using the G0022 code. And so that's one of the key differences between the G codes compared to the CHW education codes. I won't go into detail in this presentation on the principal illness navigation or the PIN codes that are listed here because those aren't specifically called out in the CHW services section of the manual for MHCP, but these are new codes that include care navigation services for high-risk medical and behavioral health conditions. I will note, so for FQHCs, there are separate codes for FQHCs and RHCs for the CHI and PIN services, which I know might be of interest to many of you on the call, and I'll try to provide some more detail in the next few slides here. But there's a separate code, G0511, that is used for FQHCs, and this code is covered for Medicare members and dual eligibles, but these services are already included in the FQHC bundled payment model for MHCP members in Minnesota. So there's not reimbursement for those services for FQHCs for straight medical assistance members, but that new code can be billed to Medicare for FQHCs and RHCs. And then the last code you can see is that S2H risk assessment code that I talked about, and it outlines the billing practitioner and the rendering provider. So again, that is the initiating provider visit by a Medicare billing practitioner, and that code is covered again both by Medicare and Minnesota healthcare programs. Next slide. So for those of you that have already been billing for CHW education services, it's important to note that there are some different billing requirements for CHW education service codes and the CHI codes. So both of these services are in the Minnesota Healthcare Program Manual and are covered by MHCP. However, the CHI codes follow CMS billing guidelines. And so I won't go into detail again. I know this is a detailed slide, but I think it's a helpful reference for after the presentation, and I'll highlight some of the similarities and differences. But so again, both of these services are covered for Minnesota Medicaid and Minnesota Care members. But when you're billing for the services, the guidelines that you follow, of course, always the MHCP manual, but the MHC manual will refer to Medicare guidelines for the CHI services. And so that's what I've tried to outline on this slide here. Again, services covered, we talked about that for the CHW education codes is specific to diagnosis-related patient education, and the CHI codes are related to addressing those SDOH needs, which includes education, but also system navigation, advocacy, social support, and those other pieces. The training requirements, Medicare refers to state requirements. Both sets of codes, the CHI services and CHW education services, require the completion of the CHW certificate program and then enrollment with DHS as a billing provider in order to bill MHCP. As far as supervision, both services, general supervision is required. There may be some differences in the supervision provider types between the education codes and the CHI codes. So again, you'd be looking at the differences between Medicare enrolled billing practitioner versus an MHCP enrolled provider. As far as starting or initiating the services, CHW education codes require an order for services by a provider, an eligible provider. And again, those CHI codes require that initiating visit by the Medicare enrolled primary care practitioner. So that's in an E&M visit or an annual wellness visit. The big differences here, again, between these two codes, the CHW education codes, services must be provided face-to-face, which includes telemedicine, and to really be face-to-face directly with the member. Whereas these new G codes, the community health integration codes, include the face-to-face visits, including telemedicine, as well as non-face-to-face time on behalf of the client. So that's a key difference, is the care coordination, the system navigation, those pieces outside of a visit, in between visits, and sometimes on behalf of the visit, behalf of the member, can be included in that aggregate billing time. And so that's the other key difference. The visit length and frequency, so the CHW education codes are really based on billing in 30-minute increments based on the number of patients or individuals or group size. And there are some limitations on the number of units per calendar month. And then the new CHI codes are billed in those aggregate times of 60 minutes for the initial visit and then 30-minute increments after that per month. And there is no, right now, there's no frequency limitation on that, other than only one practitioner may furnish and bill for those services each month. Next slide. Okay, so this summarizes some of those key considerations. I went into the weeds and the details for those of you that I know after the last webinar were looking for those details. But on the higher level here, the key pieces about these new CHI codes is they do require an initiating visit and general supervision performed by a Medicare billing practitioner. Services can be provided by CHWs and other ancillary providers billed as incident to. It can include non-face-to-face time. Consent and cost sharing is required by Medicare for Medicare enrollees, and defer to state requirements for the education and training. And then what I'll briefly talk about next, if we have time here, is that one of the pieces that Medicare has really been trying to promote is that FQHCs have separate billing codes, and then CBOs can enter into third-party contract arrangements with billing providers to provide the services. So that's something new for Medicare when they came out with these codes, is really trying to facilitate and promote how community-based organizations and healthcare organizations can work together to provide CHW services. Next slide. Okay, I won't go into detail on this slide just for interest of time. I want to make sure that after the next few slides here, Gao has a chance to speak, and then we have time for Q&A. But just to note, there are also some differences in the documentation requirements for services for those CHW education codes, the 989 codes, versus the community health integration codes, those new G codes. There's a lot of alignment, or I can see where organizations could have alignment in documentation or similar types of documentation. But again, there are different requirements, some of which I talked about as far as like the initiating of services. But in general, documentation of the patient's needs, the authorization of services, the start and stop time, the total time spent, what is the nature of activities or services that have been provided. And those are both outlined for both CHI and the CHW education codes here. Again, just to note, there are some differences, but there are some similarities as well. Next slide. Okay, the CHW service rates for MHCP and CMS, I pulled these at the time that I pulled the presentation together, and there's some caveats about the CMS rates that are listed are the national rates, and so different markets may vary. So just to note that. And then these MHCP rates were as of 2 different dates here. They're listed in the slide, but the rates listed are as of 2024. So on the left-hand side, you can see the CHI services. Again, the G009 billed in the 60-minute, the first 60 minutes. There's both a non-facility and a facility rate for both MHCP and Medicare. And then you can see for G0022, the additional 30 minutes, there's also a non-facility and a facility rate for both Medicaid and Medicare. And then highlighting that separate code for FQHCs and RHCs that is not reimbursed through MHCP because it's included in the bundled payment rate. And then there's the separate rate directly for Medicare. And then on the right-hand side, these are the codes based on number of patients for those CHW education codes. The rates are slightly different. However, it is important to note that the reimbursement rates for the new G codes are higher and again can be billed in larger increments, including non-face-to-face time. Next slide. Okay, I'm going to talk just a little bit further about FQHC provisions. So again, I've mentioned a couple times that the services for MHCP are included in the bundled rate, would not be paid separately. However, FQHCs can bill CMS for these new codes and receive reimbursement. However, as some national groups have been looking at and providing feedback on the CMS fee schedule for 2025, there have been some things that have brought out that are barriers or limitations for FQHCs on the national level as well to bill for Medicare. And there are some additional requirements for FQHCs to bill for these codes. A provider visit is required every 90 days. CMS does not reimburse for additional service time for the G0511 once the minimum time threshold is reached. FQHCs wouldn't continue to be reimbursed for that amount. Patients do pay a coinsurance based on those charges, and then CHI services may not be billed during home health services. So I'm not an expert in this area. These are some of the things that I'm learning as a part of some of the national calls that I've been a part of, and I have some of those resources outlined, I believe, on the next slide. You can go to the next slide. So there are some resources by the National Association of Community Health Centers, and then the Partnership to Align Social Care has been a group nationally that has been providing a lot of information about these new codes in the context of community health workers, and again, trying to learn to understand what the current barriers and facilitators are to these codes and to continually provide that information and feedback to Medicare for future iterations. Next slide. Okay, CBO provisions. Medicare, as I mentioned, has really been promoting CBOs entering into third-party contracts with billing providers to provide these services. And so the Medicare enrolled billing practitioner must be the one that's providing the initiating visit, the general supervision, and the one that is billing for services according to Medicare guidelines. And CBOs must meet the documentation and communication requirements with the billing practitioner. So essentially, how I understand it is community-based organizations would be setting up a contract. They might be the one that's employing a community health worker or providing the services, but it's still the Medicare enrolled provider or that healthcare organization that is the one that's required to provide and meet those Medicare services, including the billing piece. And then there was also a lot of questions that came in related to for Minnesota healthcare programs and how CBOs can bill. And there are various models that exist where community-based organizations and other organizations provide CHW services through contractual arrangements. So similar to how Medicare is envisioning these services being provided. Organizations can enroll as a billing provider entity with DHS, can contract with a clinician that meets the ordering, documentation, and supervision requirements. There are examples where there's contracts with clinics or a billing provider entity to provide CHW services, or there's also some really great models in Minnesota where organizations participate in or refer to a community health worker hub model, a community hub, or an umbrella hub. Again, I know this based on some of the questions that came in, this is an area of interest. I don't think we have a lot more detail to share on this today, but I think it's certainly an opportunity for future conversations for organizations that are more community-based, organizations that really want to partner with healthcare organizations and clinics to provide services. And I just wanted to outline that CHWs cannot enroll and bill independently with CMS or with DHS. However, organizations can contract with CHWs, CBOs, or community hubs, or other organizations that employ and provide the services. So there were a few questions about whether community health workers can enroll and bill independently and whether an organization could contract with a community health worker. Certainly an organization can contract with a community health worker, but the community health worker needs to be enrolled under a billing provider with DHS. Next slide. And there's some great resources on contract agreements, workflows, and other resources for community-based organizations. Again, there's some great national efforts, and there might be some in Minnesota too that I may not be as familiar with, really working towards, again, how these models where community-based organizations can really partner around community health worker services. Next slide. Okay, I'm going to transition on to, before we transition to Q&A, I'll highlight a few key takeaways here, and then I'm going to hand it off to Gao to provide some more details related to MHCP provider enrollment and some of the resources for the MHCP billing guidelines. Just to highlight or recap what I talked about, the new billing codes are available for CHW services that provide reimbursement in alignment with the role and scope of CHWs in Minnesota. Organizations can support the integration and expansion of CHWs through billing and reimbursement. And there are a lot of great structures that are in place to support CHW education, training, and the delivery of billable services. And we'll include some of those resources are included in these slides. And with that, I think I'm handing off to Gao to talk more about the MHCP CHW resources.
Hi everyone, my name is Gao. Thanks, Kristen, for inviting me for this meeting, just to provide some resources for community health workers. Again, my name is Gao. I work for the Medicaid payments and provider services. My role here is I do answer questions that come into our call center or provider resource center that may be related to claim inquiries that providers have issue with. Could be that they are billing and the claims are being denied and they're not sure what they're being denied. And then I also facilitate trainings that are specific, provider specific trainings that depending on the demands and needs, that I facilitate those trainings. I know that community health worker did reach out to me saying that they want a training. I am going to start facilitating that for 2025 and hopefully get those trainings out so then you guys can register for 2025. Next slide, please. I just wanted to provide some resources today that will hopefully help some of the community health worker providers today. We do have this MHCP billing resource webpage on our DHS webpage. The PowerPoint I did also put a link on the screenshot So hopefully you guys can navigate to that. If you are new to billing or if you're just want to know what kind of resources we have here, this right here page is a very, as a trainer, when I first started, I religiously came to this billing resource a lot. You'll find if you're new to not knowing how to read your remittance advice or how they come in, here's a great way to that there's a link on remittance advice, and it will take you to a web page for the remittance advice to show you how the remittance advice will come in, and it also gives you like a PDF version of a fake what your remittance advice will look like. Another thing that I also think it's really good is the MHCP fee schedule. There's a link under the general billing information. If you're wondering what procedure codes are that can be billable, if they're reimbursable, here is a great way to click on the link to see what procedure codes are reimbursable. It will give you the procedure code, the effective date, if there's a service authorization needed or not, and also give you what the reimbursement amount is. And so again, this is a really good resources. If you're new to billing, definitely come here and check out this billing web page here that will help you navigate to certain resources that you may need as a provider. Next screen, please. Next slide, please. So here is our MHCP provided training webpage here. The first thing I highlighted was our on-demand video. Again, if you're new to billing, we do have these short instruction videos concept that are listed under specific topics. They're under 10 minutes or so. These are on-demand videos. We facilitate these ourselves. And so if it gives you like a good layout instruction of specific things you may need as a provider. So sometimes, like I mentioned about if you don't know how to read your remittance advice, there is a video that shows you how you read your remittance advice. There's also a video that if you are trying to log into minutes and you're trying to learn how to use your mailbox, because we here as a trainer, we communicate a lot and through provider news and update and dropping things into your minutes mailbox. So if you're new to that, here's a great video that will show you how to navigate and access your minutes mailbox. Next slide, please. On the same page here on the MECP training webpage here, if you scroll a bit down, you'll see that we have online trainings. One training that I do recommend as a new provider or just a provider that wants to retain or see what kind of resources we have, a provider basic training. Once you click on the link, it'll take you to the specific provider basic training webpage. It will give you like an outline of the agenda where it's going to be covered. It'll also give you if there's any materials that you may need before the training itself, and then what resources that they provide on there. There's also provider specific training. So if, like I mentioned, I do plan to facilitate a community health worker training in 2025. Once that is approved and everything looks good, then it will be posted on the provider specific page here. And it will take you pretty much, it will navigate to the community health worker training page. It'll list you all the dates that are available that you can register for. It'll list you what the agenda will and what I will cover in the training. So I do say do check out this online training pages, even if you don't do community health worker and you want to just see what other provider specific trainings there are, come here and check that webpage out to see what you want to enroll in. Next slide, please. So we do have a Minnesota provider screening enrollment portal training webpage here too. So if you are new to the portal, or if you hear the term MPSC portal, I have our specialty here is, his name is David. He and the MPSC portal team, they facilitate a Q&A session that you can come onto this page and click on the little blue link to join. So this Q&A is for general inquiries, questions that is related to the MPSC. So a lot of providers may not know that this Q&A exists. So if you have general questions regarding to the portal itself, here is a great way to come and join the meetings that David facilitates himself to. Next screen, please. Here is the community health worker manual. So if you are new to the manual itself, if you're wondering what's covered, it gives you a good overview what eligible providers can be billed for and what educational that community health worker will need to have. Here's a great page to come to our manual to read about the community health worker. Next screen, please. Here is our basic instruction 837P professional claim. So if you are a provider that you just want to know, because when you go into minutes, it can get confusing. So we have these user guides here that will show you a specific field of each steps if you are billing through minutes to show you what you need to provide and what information. It gives you a little description of it, and it also gives you what should be entered in on there. So for example, as a community health worker, you affiliate with the organization, and the organization, it bills on the behalf of the community health worker services. So it will give you a step like what needs to be entered in this field, what codes can be entered here, or and so forth. Here's a great way to come and refer to this basic instruction user guide if you are billing on the professional claim for community health workers. Next screen. So that pretty much gives you all the resources that I provide. Again, I do recommend community health workers or any providers to sign up for any of our provider training specific training sessions. If you do have any questions, that's when we'll answer questions. And if you have any billing questions for that specific provider type, that's when we will specifically answer those questions in those sessions. And we also go through minutes when we go through those billing labs.
All right. Thank you, Gao, for providing those resources. So now we have time, or we left time to be able to have Q&A. And so we have some proposed questions here, but certainly if there are other questions that came up for you during our presentation or the resources that we provided, myself, Gao, and then Lavina from DHS are here to answer the questions that we can, and again, gather any additional questions to include in an FAQ document after the webinar. And Catherine, I don't know if people need to put questions in the chat or if they can come off mute. I don't know if you have specific ways that you like people to ask questions here.
Yeah, we actually need them to put that in the chat if they could.
Okay.
I see you put a bunch of links, so I appreciate that, Kristen. We don't have any questions as of this moment. You want to talk about maybe the ones that you have so far, and then if we have any other come up, I can let you know.
Yeah, I'll see. Again, I think we tried to cover as many of the questions as we could in the webinar itself, but I'll pull up some questions here, and then between the three of us, we'll try to answer those questions. Okay. Let's see. I don't know if Gao or Lavina, there were some questions related to billing for CHW services, related to dental services, fluoride varnish, application billing, and other questions related to dental services. And I know for the CHW education codes that there are some provisions in the manual for eligible billing providers in the dental setting, and that education related to dental services would be included. But I'm wondering if there's anything further that you would like to share related to dental services. And the specific question is around fluoride varnish application billing.
I think you covered it. The provider manual just stated a little bit about it, and that's really explains in detail, or not in detail, but explains the billing that you can do for that and the codes that the CHW can use to bill and make sure that they're billing or they're supervised by a dental provider.
Great, thank you. Okay, I do see a question in the chat here. Can you give more details about the order for services for the education codes? Can those be standing orders? So I'll take a stab at it, and then Lavina, you could jump in if needed. So my understanding is that, again, DHS outlines that an order for services is needed. My understanding is that there are some organizations that have standing orders in place that meet those billing requirements. So I don't think that DHS indicates specifically in the policy related to standing orders, but it's my understanding that some billing providers do use standing orders and have that in place. Lavina, anything to add on that?
Nope.
Okay, and the order for services. Tara or Tara, I'm not sure if you had more questions related to the order itself. There are some specific details in the provider manual that outline what is needed for those, and I can pull that up in a minute here. And as far as there is a section that talks about the order and what needs to be included in the order. I don't know if Lavina, you have that off the top of your head.
What is the question?
So the question on what needs to be included in the order for CHW services for the CHW education services.
We don't specify that. I guess you just need to be under an MHCP enrolled provider. I think that'd be up to the provider, like what is contained in that order, what their policies are for that. But we don't give any specific specifications in our manual.
Okay. I just put some info in the chat there too. Thank you, Lavina. It says the order must specify the number of units ordered and whether the group or individual services. Okay, next one. We have a sense of copays patients have to cover after billing. For those who have been billing, what process do you use to get patient consent for services if they will be billed? What proportion of patients decline service because they will be billed? I do know on the national setting, and there's some good resources through that partnership to align social care about as far as for Medicare members, that the number of members that actually end up needing to pay copays if they don't have coverage is very small. So that's my understanding, is that there's a small number of Medicare members that actually are responsible for copays, but that's just what I've learned from the national setting. I'm not sure if Lavina or Gao or anyone else on the call that wants to put in the chat has experience with if patients are, what their copays look like, or if for MHCP are their copays. Lavina.
It really depends on the member. So they may have copays, and copay is something that in our manual, we do have a specific section that when you can bill to the member. Let me see if I can find it. But copayment is one thing that can be billed for the member just because the member is responsible for their copayments. Let me just see if I can find it really quick here. So here is the manual itself that talks about billing the member. So again, hopefully that went through. So that is one thing that can be billed to the member. Then there are circumstances where there might be a service that is not covered. We do talk about a scenario where if there is a service that it's not covered, you want to just make sure that service is not ultimately covered at all. When it's not covered, you want to make sure that you complete a specific form that we have listed. It's under the same manual, but if you go to non-covered services, it talks about the advanced recipient notice of non-covered services or items. So when that does happen, you want to make sure that they meet it's not ultimately covered at all, not by service authorization or anything at all. They meet the criteria that's not covered. You need to make sure you notify the member that it's not covered. You complete the advanced recipient notice, keep that in a file, make sure that the member also signs and date it correctly. And then if it does happen, then you just want to make sure that you have that advanced recipient notice on file. Does that answer your question?
Okay, I don't see, yep, she said that is helpful. Let's see, it looks like I thought I saw another question in. Okay, do you know if any F2HCs have already billed the CHI codes for MHCP recipients and if they've been paid? If so, can you share which clinics? So I would love to know. I'm not aware of any organization that's billed for CHI codes. I know I've requested data from DHS on that, but I don't know if there's any organizations in Minnesota that have billed for CHI codes. I don't know if Gao or Lavina would know that.
Yep, I can refer the questions. As right now, I have not seen any FQHC bill for any cheat codes at all on my end. Most G codes are not covered for FQHCs because usually FQHC, again, they are paid an encounter rate, and a lot of the services are included in the encounter rate.
Let's see. Scanning through to see if I see any other questions. Yeah, so just a comment about the concern about co-pays and cost sharing. And maybe that's something we can try to include a little bit more about in the FAQs document to provide some resources on that as well. Yes, that's definitely, we want people to be able to access the services and not have those co-pays be a barrier to CHW services. The question about telehealth, I don't know if Gao or Lavina, you can speak to the telehealth component of these services. My understanding is that all of, let's see, I'll speak to, I'd have to look back at my slides specifically, but that my understanding is that under current guidelines that are covered for telehealth visits, which again, I know some of those guidelines may be changing as in 2025, at least for Medicare, but my understanding is that telemedicine, so for the community health worker education services, that those need to be provided face to face, but that includes telemedicine visits or whatever meets the definition of telemedicine, but it wouldn't include, if telehealth is considered like just on a phone call, that's not considered a visit, that wouldn't be billable under CHW education services. My understanding is that the CHI codes, those follow the CMS guidelines, and again, those include face-to-face visits, including telemedicine, but would also cover non-face-to-face time, including coordination with the client or the member or the patient outside of visits and on behalf of the client as well. I don't know if that answers the question, or if Gao or Lavina, if you have more information on that telehealth question.
Yeah, I can tap on it. So I'm going to put the telehealth manual into the chat too. I'm not the expertise in telehealth, but if specific, Kristen had mentioned there's certain codes that can be telehealth. So when you are wanting to bill for telehealth services, you want to make sure you complete the form. There's a form that you'll need to complete for telehealth before you can provide telehealth. And that form, once the telehealth form is approved, that's when it does not get backdated at all. So when that telehealth document is approved, that's the date that you can provide telehealth services. Before we used to have we included audio, but that is going to end as of next year. But I know there's the audio, there's a few things that in the telehealth that you can review regarding to what telehealth is acceptable or not. But again, you do need to make sure that you get approved for telehealth if you're providing telehealth services and complete those the required documents before you can provide telehealth. Otherwise, your claims will get denied if you don't have the telehealth requirements completed.
Thank you, Gao. Okay, we're right at 12:59, so I think we probably need to hand it back to Catherine. I want to thank Gao and Lavina for joining me today, and we'll compile any different questions, other questions that you have, and do an FAQ document.
Wonderful. Thank you so much, Kristen. If you wouldn't mind going, Sadie, to go to the last screen would be great. We're going to include some resources once the PDF or the slides are going to be available, hopefully early next week. We just need to make them accessible. And we'd like to thank you again for joining us. And thank you so much to Kristen and Gao and Lavina for joining us. This information is obviously very informative, and we couldn't have done it without you. And thank you for joining us today on this Healthcare Homes webinar. Please don't forget to complete the survey, as this already has been placed in the chat, and it helps us plan for future webinars. And a big shout out to Sadie Anderson for everything she does in the background. We couldn't make this run without her. You will receive a follow-up email soon, hopefully with the slides and resources and link to the survey. If you have any questions, please don't hesitate to contact us at health.healthcarehomes@state.mn.us. Thank you for joining us this afternoon and have a great rest of your day.